I'm Dr. Erin Elliott.
And I'm Jason Tierney.
I'm a dentist.
And I'm a dilettante. And we're going to talk about sleep matters because
sleep matters.
Erin Elliott, Dr. Erin Elliott. Welcome back to Sleep Matters.
It's so good to be back, Jason.
You're here in Arizona.
And
I know
it's
you love
so wonderful.
Idaho, but Arizona.
This is a great little getaway. And, we get kind of a cold spring, although we've had a lot of sunshine this year. It's always nice to pop down to Phoenix area and just get some sun.
Yeah, and here it's gone from summer straight into summer. I'm glad we're here with two guests today. It's 2v2 today. So we've got Jim Marsh and Dr. Gardiner, and we're going to talk about binaural beats and some other things. But Jim, Dr. Gardiner, why don't you tell us who you are and why you're taking time to talk with us today?
Sure. Thank you, Jason. And hello, Dr. Elliott. Good to see you guys again. My name is Jim Marsh, mechanical engineer, factory automation, and I like to invent things. One of the things I invented was something called the SleepVibe, which I think it helps people get better sleep, and I think we'll dig into it later. And like to introduce Dr. Gardner, and I'll let her take it from there.
Thank you. Thank you for having us on. Very happy to be here. My name is Dr. Gardiner. I am a PhD research associate. If the accent wasn't a giveaway, I'm from the UK originally, moved here to the States 3 years ago, and I work with Washington State University. My research program is quite broad, but always anchors back to sleep quality. So we got connected, me and Jim, some years back, and we've been working on a project since, which I'm very excited to tell you more about at another time. Happy to dig into this.
So
thrilled that you're here. Did you say from the UK?
Yes. Yeah. South of London.
I could have sworn that was from Memphis. Huh. Anyway, I guess I was wrong.
I thought you were going to come in and say Australian. I get Australian guest all the time. I nearly filled in the blank for you and was like, don't say it.
I thought it was Memphis. I was wrong.
Not even close. But she moved to another rainy place, so it's perfect. So Dr. Gardiner is at Washington State University in Pullman, Washington, and Jim Marsh is basically based in Spokane. And we got connected because I have some business consulting patients, really great couple that just loves what they do and loves helping others. And so they said that they had a client that was doing something with sleep and that they wanted to connect us. So Jim and I had coffee. And what's interesting is he's really got a really great story. And you're probably wondering, why is a mechanical engineer on here? And a really great story in that led to what's called SleepVibe. And he found something that was working. I think you did a study of your own with a placebo, and he was really onto something. And so Dr. Gardiner came in so that he can, I keep saying we like I'm part of it. So he can really put research to the findings that he's already experienced. So Jim, could you please tell us how and why a mechanical engineer would be so into finding a way to sleep better?
Well, in 2020, my wife was spiraling down with something similar to Parkinson's disease. So her body was deteriorating, but her mind was fine. At one point, she was only sleeping 1 to 3 hours a night. And because it was COVID, we couldn't get caregivers. So I was the caregiver. I was sleeping less than 1 to 3 hours a night for months on end. And we tried everything. We tried medication. We tried Calm Tea. We tried sound files. None of it worked for either of us. So I took a magnetic field and put binaural beats with it and created a prototype that is silent, but it has binaural beats. I tried it on myself, and uh, I lay down on my side and woke up 9 hours later. Um, so after several nights of that, um, my wife decided to try it, and she slept all the way through the night as well. So after she passed in 22, then I decided to try to bring it to market. And um, as you mentioned, Aaron, I did an A/B test. I gave some friends 2 units, one with an A, one with a B. I didn't tell them anything else. I just said, "Tell me if your sleep changes." Um, they did a. I said, "Start with the B," and all of them said, "Nope, no difference." And I thought, "Great," because that was a placebo. So then I asked them to try the A unit, and all of them said, "Wow, what is this thing?" One person didn't want to give it back. She said it was the best sleep she's had in decades. And all of them purchased a unit, and all of them are still using it 3 years, almost 4 years later. So
And the
I
best
figured,
part, oh, sorry.
no, please go ahead.
What the SleepVibe is essentially it's just a box. I mean, and it's light, so you're kind of like, what is this voodoo, you know? There's no subscription, there's no Bluetooth, there's no EMF frequencies. Literally, I plug it in, and you do need an electric outlet, but I plug it in, I put it under my fitted sheet just so it doesn't move around much, and you go to sleep. And some people might notice the first night depending on how sleep deprived they are. And I think you say, Jim, to give it up to 2 weeks to really kind of let it work. But my next question kind of has to do, and both of you can answer, is why were you looking at binaural beats to begin with? And what are they? And are they legit?
Well,
I'm bouncing that to you. You're the inventor here, so you go
um,
right.
I was looking at it. I was looking at anything that would help, and uh, I heard binaural beats had some success with sleep, so I just ran with that.
So
Um,
can you explain what those are for listeners that may not know?
sure, binaural beats is basically if you put a pair of headphones on, and one ear has a frequency of 100 hertz, and the other ear has a frequency of 200 hertz. The brain automatically creates a third frequency that's right between those. So in this case, 150 hertz. Um, and scientists have found, and I'll leave this to Dr. Gardner, but at the time I had heard that works, and for depression, sleep, anxiety, and I said, "Oh, sleep." So I tried that and made my own version of that using a magnetic field. So it's very low frequency, low power, and very near Earth natural frequency. And I tried it, and like I said, it worked. So
Was the binaural beats, did your wife listen to those prior to you putting it in a
yes,
speaker?
we had sound files. There's a lot of sound files that you can download, um, but it didn't really help her. So um, I was really happy that she responded better with the magnetic field. And again, it's silent, but it's still the field actually helps us relax. So
Dr. Gardner, could you expand on the binaural beats and
Yeah.
why it works?
Yeah, in terms of the why it works, that's still something I'm very much like junior to, and I'm learning as we go through this process. But in terms of research on binaural beats and sleep, there are papers, there are manuscripts, there is published work and data on this to show the benefits. Um, So if anyone wants to take a quick Google Scholar search, if you search for the keywords of binaural beats, sleep, and something like effectiveness or efficacy or like trial, then you can definitely find some established work in that area. So yeah, there's some really good review papers out there. As was mentioned, it's not just for sleep as well, but for mental health, depression, anxiety. And I think further to the published scientific clinical trial style research that we have here, the testimonials and the customer feedback really speak to volumes to what it is. So there's something to be said for, yes, obviously the science, the clinical papers are wonderful. But if you just go and ask people who have used this, especially SleepVibe, you'll really hear the benefits from people themselves. And I think that is the best data you can get in a lot of ways.
And I've taken a deeper dive on this as well, if I'm going to be like using it myself or talking to patients about it. What is it almost like it distracts the brain? Like, why does it work? Is it I know brainwave entrainment is one of the buzzwords that's used, but exactly does that mean?
So there's some I believe the phrase proprietary stuff here with SleepVibe, so I don't want to overstep and overshare. So I'm going to bounce that back to Jim in terms of exactly how this is working, because I don't want to overstep.
Yeah, or even binaural beats in general. How's that? Why why it helps mental health or depression? Is it because it takes the brain's thinking away from does it help focus on something different?
I understand your question 100%. I don't have a full comprehensive answer to that. So my first step into this is with SleepVibe, and my main role in this is our trial testing and getting that
Gotcha.
feedback from people. So I'm not really in the depths of the mechanistic side of things. In terms of this one, my role is more about asking people about their sleep, getting self-report data,
Gotcha.
and things like that. So I'm more on the data collection side rather than the mechanics side. So if Jim, you do have something you want to add to that, I will let you field that one. But in terms of the mechanics of how that works, I'm not quite there.
So, one of the things that I found was transcranial magnetic stimulation. That's a long phrase, but it goes by TMS, and there's clinics all around the U.S. It takes a medical doctor to use it, and basically, this has been approved as safe by the FDA, the TMS. And somebody puts on a helmet, and they position electromagnets over different areas of the brain, and it basically the magnetic fields actually fire different areas of the brain to cause a new pathway. So for addiction, for instance, alcohol addiction, I actually had a friend. This is how I learned about it. I had a friend that went through the process. It took 6 weeks and of daily sessions, but a year later, 2 years later, he has no craving for alcohol. It basically caused the brain to have a different pathway. Instead of ending at alcohol, it ended in a healthier place. So I that's why I chose the magnetic field. It was similar but very low powered compared to the TMS, um, and put it with the binaural beats, and it worked. So
Yeah, we have TMS clinics popping up all over the place around Spokane and even Coeur d'Alene,
yeah.
and addiction, depression, that sort of thing. And you have to go in every day for however 15 minutes for 6 weeks or something like that. Why not have something that can just be put under your pillow at night? Can SleepVibe kind of translate into those other things? I know you're not probably researching that, but that just came to
Uh,
mind.
yeah, I don't know. Again, that would probably be
Yeah.
IP stuff. Uh, I do have other versions of it, and they do some amazing things, but because of IP, I can't really talk about it. So I'm sorry.
Oh no, that's okay. I was just
We
like,
were
oh,
we were
I
just
wonder.
trying to get the premiere info here.
Yeah.
But so Aaron and I have some friends that are going to hear this, and they're going to say that was really irresponsible of you guys to have Jim and Dr. Gardner on, just sharing anecdotal information. Now, talking about uh, my own experience, instead of it's me search, um, and using that as validation for this product. Can you talk a little bit more about what maybe you're doing at SleepVibe to bolster some of this anecdotal experience with some data to support its efficacy?
Absolutely. I'd say there's two levels to it. One is, I wanted it to be safe, so it didn't need FDA approval, but it is approved as safe by a FDA approved lab. And again, because it's so low powered, it was considered safe. So I felt comfortable moving forward. Um, Again, a lot of people, as we know, a lot of people have trouble sleeping. So I used it with friends to begin with. I used it on myself first, and then I used it with some friends, and they got a very very good response.
Mhm.
Um, and I just continued to develop it, and again, it's 5 volts, very low powered, and um, if nobody's had a negative reaction to it.
Mhm.
But if they do, they just turn it off.
Mhm.
As a matter of fact, some people use it for 3 years and they say, oh, maybe they don't need this sleep pipe thing anymore. And they turn it off. And within a day or two, they go back to whatever their poor sleep pattern was.
Mm.
And by the third day, most of them are like, well, this is crazy. And they turn it back on and they're
Mm.
back to very good sleep. The
Well, plus you
other,
have a 30-day guarantee and how with
absolutely, yes,
yeah.
100% money back guarantee, 30 days. Um, I don't wanna sell anything that somebody can't use, so,
Mm.
but I wear a Fitbit watch, and I can see the difference, on that. Um, Dr. Poppy One of the reasons I'm working with Dr. Poppy is we're we are doing a test, it's a clinical trial, and, um, I don't wanna talk too much about it, but we're using research grade, uh, watches that actually track sleep on a research level, and, um, I guess I'll let Dr. Gardner, fill in from there.
I can certainly do that. I will do my best to answer the question and, like, address the concerns about it being research versus the research. Um, that said, as we are still very much in the depths of the trial, we can't really share too much about it just now. But at an overview, we are looking to work with trying to think of the best way to describe the Jim, do you mind if I say the population? Trying to think of the best way to narrate
Yes,
out.
I think that's fine. I think it's fine.
Okay. So we're working with shift workers in a healthcare facility. Typically, we are looking at nurses, but all people who are working at a healthcare facility on a night shift are welcome to join the project. What we are doing is we are giving self-report surveys that are validated, and as mentioned, the research grade actigraphy, which is like a fancy Fitbit. We're giving that to folks and we are analyzing the data without SleepVibe and then comparing that to with SleepVibe. So we will be able to, in the near future, draw some conclusions from an external participant base, more so than the friends, the family, the connections, the network that Jim's
Sure.
already. It will be a completely blind, as it were,
Sure.
external participant base, and we're hoping to get between about 30 and 40 folks in that study. And then we can run statistical tests. We can look for effect sizes, and we can say with confidence that statistically, hopefully, there's a benefit there of sleep.
Sure.
But that's about as much as we can share right now. We are still recruiting. It's going well. Participants are completing the data as needed, and all good feedback thus far. But I can't share any more in terms of
Understood.
numbers and figures and such. But it's going well.
Good deal. Good deal. And as far as binaural beats, Erin mentioned earlier that there's been some research to support that it can be effective for things other than sleep, things like focus and depression, mood, etc. Um, is the Without asking you to show all of your cards, I mean, is well, here, let's just go back to, sort of the me search anecdotal evidence. Have you heard positive reports from users of SleepVibe about those types of things as well? So things beyond just improved sleep, but improved mood, improved focus, whatever it might be?
Well, I think, and again, I'll refer to Dr. Poppy for the fine tuning of this, but basically, sleep is so important. In taking care of my wife, I became very sleep deprived. My sleep deficit was very high, and what I noticed is it was high enough that my memory, my working memory, was 3 to 4 seconds. That meant if something happened and I said, "Oh, I need to tell our doctor about that," I had 3 to 4 seconds to write it down. Otherwise, I couldn't remember what it was. It was gone. Emotional reactivity uh, was was much. I was a lot more emotionally reactive, and I'm looking at that, going, "This is crazy. Why am I acting this way?" But I quickly realized that it was due to the lack of sleep. Um, so it just affects us in so many ways, and I think everybody here has can chime in on this. Um, so people like Dr. Poppy mentioned, shift workers, first responders, which have they have to get up and be active and out the door in a minute, maybe two, and they have to be clear headed, so they can't take opiate based medications to sleep because they're making life and death decisions, within 5 minutes. Um, the military also has uh, typical civilian population, 30% don't get enough sleep. I think that's a little bit low, but the military, it's more like 60 to 75%.
Mhm.
So they really see a strong need for it. There are people working at nights, fixing airplanes, or people in Amazon warehouses that work at all kinds of crazy hours.
Mhm.
And Sleep Vibe is helping them get a good night's sleep in the time that they have available.
Which then leads to better focus, mood. If Jim Marsh is reactive, then you know something's wrong medically.
Yeah.
We have seen, I can only say this broadly, but in our research project using SleepVibe, we have seen benefits above and beyond improved nighttime sleep quality among the shift workers. Those who have found it to be the most beneficial for their nighttime sleep have then gone on to report improved daytime mood and functioning as well. So we are seeing that in the research.
And
Transform. Okay.
uh, are there um, competitive products or similar products on the market?
There's a lot of sleep products, a lot of claims that cannot be substantiated. Um, it's pretty messy, but we we really break it down to three different categories. One is it makes a better environment, so better pillows, nice sheets, a good mattress. Those are important, but they don't actively help people to get to deeper sleep. Um, sound files, white noise, things like that. Then there's a group where they use other methods. Usually it's attached, a watch that attaches and it vibrates on their vagus nerve. So these are I can't say I haven't tried them, so I don't know how effective they are. Or people need to take 20 minutes in their day and do a meditation. These are all valid. SleepVibe is different in that you just plug it in, you put it under your pillow. There's nothing attached to you. There's no sound. It doesn't bother anybody else in the room. Um, and I know of one or two devices that are somewhat similar. I've tried them, and uh, SleepVibe was way better. So
Yeah, got it. Erin,
So
has Tom used the sleep vibe?
that's what I was
This
just
sounds
gonna
right up
say.
his alley. He could be the
Yeah, at
spokesman.
Transform Dental Sleep, there was a very powerful, hard-hitting lecture done by me about biohacking and what a lot of our patients are reaching for. And when biohackers believe in the 4 pillars: nutrition, exercise, well-being, and finally sleep. And every single biohacker you meet will tell you that they're severely lacking in sleep. And it's like they reach for the supplements. They reach for, um, yes, I was laying in bed and I'm like, what's shocking me right now? And it was our grounding sheets. I was cuddling up with Tom and I was like, what is going on? What's vibrating right now? He had some ankle monitor that was supposed to help him get better sleep. And he's sitting there at night. If you could see my face right now, he would like go into I'm like, what are you doing? It was a vagal nerve stimulator. So yeah, there's a lot of things out there, unfortunately, and I'm glad you're doing the research because so much of it is just kind of hokey or, this is what you got to be doing next. And so my message at Transform was we have to be looking at the airway first. And that's the part that's always forgotten. And that's where my message is to the general population that all these things are great. The sleep environment, the things we reach for sleep hygiene, getting the proper amount of sleep, sleeping in Faraday cages now, all sorts of things that are getting done, but the airway is never looked at. Unfortunately, if they do get a sleep study, it's looked at 4% instead of looking at RARAs. And then when we do treat the airway, you're still going to have those patients with COMISA and, comorbid insomnia. The goal would be by treating the airway, they get better sleep and aren't woken up. But you'll still have those patients that do. And so I feel like SleepVibe is that next tool in my tool belt to help these patients that when we know the airway is good, that this can help kind of bridge that gap with the insomnia that continues. So Tom, yes, he has his own SleepVibe. Technically, we probably could have shared one because I believe it's you should sleep within 18 inches, is it, Jim?
yes, that's correct.
Yeah.
So you could
So
put
we
it
could
in the
have put
pillow.
it in the middle of our bed, but
Yep.
we have like we have our own zip code in our big bed. So we each got one. And it's interesting because we were in a hotel last night. I put my appliance in and went to sleep, but I guess he said he was tossing and turning all night. So I think that it was part of it, is not having a sleep vibe.
He
And
didn't pack his sleep vibe.
and it really is best in your own bed, right, Jim?
Yes, initially, but after you mentioned entrainment, after the brain kind of tunes into the sleep vibe, uh, then people do take it for on trips and
Mhm.
especially international trips. So one person was in San Francisco. She flew to Singapore to see family, then to London and back. That took her a month. And typically it was 3 weeks before she'd be like 80% circadian back on the West Coast. Within a week, she was 100% back and had no jet lag with SleepVibe. So it really does help to set the circadian rhythm, as Dr. Erin said. You need to do good hygiene, but
You
it
know,
does help.
Jim, I'll tell you, I came in here with, we met at Transform.
Yes.
I commend your efforts, but I came in here with a little bit of skepticism. But I think I'm going to have to check out a SleepVibe myself.
I will tell you that a lot of my crew did buy one, and I've seen the follow-up text. They're like, I don't know, I don't understand, but I really think it's working. I had a friend whose husband was sleeping so great, and then he started freaking out because it lost its, effectiveness. She went on a trip, and he was texting her like, "I'm not sleeping," and anyway, she had accidentally unplugged it. So that was a good placebo test. For sure.
Yeah.
So you keep hearing stories, but I do think that one other component is making sure the airway is treated as well, because I think it'll just be that much more effective.
Absolutely.
Just while we're sort of on that topic, Jim, did you want to mention the benefits that people have seen in either their own snoring or their bed partner's snoring? I know snoring doesn't always equal sleep apnea, but just while we're sort of on the topic there of the airway, I didn't know if you wanted to just jump in on that.
Well, to Jason's point, we don't have clinical data on this, but typically the wife buys a SleepVibe because their husband is not sleeping well, and they one person had an app on their phone, and they could hear both of them snoring on this app. So they bought a SleepVibe, um, and then he stopped snoring. So now the app only records her snoring. So
Can't blame it on him
um,
anymore.
Yeah.
but I hear this from the wives. It's like, the wives are getting better sleep because the husband isn't snoring so much anymore.
Sure.
And I can't explain that. I'm gonna turn that over to Dr. Erin and Dr. Gardiner to help explain that. But
We want to
it's
research that.
it's very curious.
Yeah, we really want to get stuck into that. We're hoping that this first round of research, this first round of trials, will have results such that we can take it to funders and do grant applications to try and research this further in different groups and with different outcomes. And snoring and sleep apnea, that's really where I want to take this, because that's what I and we are hearing from a lot of people, is a reduction in snoring. And I don't know the mechanism as to how exactly that's working, especially if it's obstructive. I physically don't know the mechanisms here,
Sure.
but we do want to research that moving forward because it's very interesting.
Very interesting. And where can people go to order a SleepVibe for themselves or to learn more about it?
Sure, our website is the sleepvibe, VIBE.com. And we do have more information. You can also purchase one. And again, it's 30 days, 100% money back guarantee if it does not work for you. So, and we have very few returns.
Very cool. Well, we'll be sure to put that in the show notes, and keep an eye out for my order coming through, and you'll see that. Heck, I might get that order placed before we wrap up this episode, but
And if,
I'll be sure to provide you with my candid feedback.
and if you're
I look
listening and
forward to it.
tried one from Transform, we are kind of working on an in-office type of program where your patients can walk out with it, so you don't have to wait around for them to order it.
Very cool. Very cool. Well, we'll put all that information in the show notes, and then we'd like to play a little game that we do here on Sleep Matters called the Final Countdown.
Oh gosh.
So we've got 4 questions we're going to ask you, and you have a total of 30 seconds to answer these questions. Okay?
Will we put them together or separate?
You're going to answer them together, so you're going to have to answer extra fast. We're not giving you any more time, okay? And if you don't answer in the allotted amount of time, a bucket of slime will pour on you like on Nickelodeon, okay?
Got it.
We know where you live. Okay. So question number 1, and you have to answer these in rapid succession. Question number 1, if money didn't matter, what job would you do? Jim.
Be an inventor. I love it. I love puzzles.
Poppy.
I'd be a wedding planner.
I wish your answers were reversed there. Okay. 2, Dr. Gardner, have you ever been fired from a job?
Nope.
Jim.
No, actually.
All right. What's the worst movie of all time, Jim?
I don't have any time to think, so Attack of the Killer Tomatoes.
Dr. Poppy, what about yourself?
Oh gosh, it has to be like something 2. Like
Some sequel, right? Yeah. Pick the movie, any sequel, right?
You're right, because the answer is Anchorman 2.
Yeah.
Oh, yes.
And then, Dr. Poppy, do you believe in ghosts?
Oh, not no, but not a strong yes. Maybe.
Okay. I
I'm with
like
you
it.
on that.
Jim, ghosts, yeah or nay?
I do, yes. Yes. I'll leave it
That's
there.
I think there's a story there.
I think that
Yeah.
There is.
And then you're being announced up on the grand stage. What's your theme song, Jim?
I'll defer to Dr. Poppy first.
the first song that came into mind, which is ridiculous, is Eye of the Tiger, which is so not fitting to who I am, but it just
But wait a minute, Dr.
Makes
Poppy.
you feel strong and powerful.
I'm not sure that we know that song. How does it go?
I recommend you YouTube that. Nobody needs to hear this sing.
All right, Jim, what about yourself?
I'm still drawing a blank. I guess I'm
Eye of
looking
the
at a
Tiger it is.
slime.
Sure.
Dun, 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 dun. All right, well, Dr. Poppy, Jim, thank you for being here with Erin and I on Sleep Matters. Thank you for sharing with us about the SleepVibe, and hope to see it transform next year, and hopefully somewhere before then. Will you be in Chicago at AADSM?
I will, yes. How about you guys?
I will be. Erin, you won't be, right?
I cannot be there. Triple booked.
Okay.
I will be there though, and I'll be sure to get my SleepVibe before then and give you some feedback in person. Deal?
And Dr. Gardner, I hope
Deal.
I see you in person.
Yeah,
I'll
definitely.
meet you in person. Yeah.
Yeah, thank you so much for having us on. It's been great.
Thank you for your time.
Jason, I will say that I'm already signed up for TDS next year.
Excellent. Well, on that note, dun, 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 dun. All right. Well, thanks so much, y'all. Take care.
All right,
you
thank
so
you.
much.
This is great.
Bye-bye.
Bye.
Bye.
Sleep Matters.